Okay, and we are live. Hi, everybody. Happy Friday. Happy Aloha Friday. Thank you guys so much for jumping on this call. So, a little bit about what we're doing tonight. So, Kawaile Hua and Noelle and we both share an amazing woman who just jumped on, Lori Kimata. She is our midwife, birth fairy, whatever you want to call it, goddess of all the Haumea vibes. She is such a huge part of our life and our journey to motherhood that we really wanted to host a call highlighting not just what we have done in our pregnancies, but what she has enabled us to do, what she has taught us to do. And so we thought it would be a good idea. Me and Kwailekua, one day we were just talking, we were like, how in a class with, what if we asked Dr. Lori to be our special guest? And we both got so excited. It was like, yeah, Kwailekua, we were like, wait, no, really? Can we do this? Really? And so with COVID-19 going on, like it's all an opportunity for us to be able to connect virtually. And I feel like now more than ever, people are able to join classes like this and gather and get information in a setting like this because we're all home, because we're all able to be with our families at home right now during this time. So I want to send a humongous shout out to Kuelehua and Noel for helping me and agreeing to help co-host this class for us. And what this class is about is we wanted to talk about natural medicine or natural solutions when it comes to pregnancy and birth. Those two things in particular, because obviously they link up together so beautifully, but it's such a topic of conversation nowadays. We have so many choices when it comes to what we do during our pregnancies, what we choose to do during our labors, what we, just even down to the positions that we take, the supplements we take, all of that kind of stuff. And we really wanted to bring in somebody that not only do we trust, but has had years and years, but doesn't look years and years old of just this incredible practice of natural medicine. And so a little bit about myself. My name is Jordan Kamara. I'm a mother of 3. We live in Kaneohe, Oahu, and I have 3 children. I home birthed 2 of the 3 of them. The first birth was at a hospital, and it was a beautiful birth nonetheless. And it actually was because of that birth that I was sure that I could transition my next 2 babies or the next baby into a home birth, because of the way that I had such a amazing holistic birth in a hospital. And so from that, I was recommended, when we got pregnant with my second baby, I was recommended one woman in particular. She was always at the tip of everyone's tongues. You got to see Dr. Lori. You got to see Dr. Lori. You got to see Dr. Lori. And from that, we met, and I truly believe in love at first sight. And it was just like me and my husband both were just like, yes, we're doing this, no question. And she has been a part of our lives ever since. And we kind of just jumped in with this home birth mentality, with this natural approach to birth. And I didn't realize how much my mindset would strengthen and grow because of the things that I was being told and taught. And if you follow me on Instagram, I just did a post the other day about what it looks like to slow heal, what it looks like to, heal from home, what it looks like to be able to connect with our doctors and our healthcare professionals, and actually be able to sit down where they talk to you and they find out all the things that is going on. And they're not just like, oh, you have a cold, here's some, OTC. And I really love that about the healthcare professionals that we have in our life, is that they really do take the time to listen, slow down, to be like, what have you eaten in the last 24 hours? How have you been feeling? You know, like it's been a crazy time. And so it it's just been huge for our family to be able to shift into this new mindset. Not new, it's generations old, you know, like to reshift into what our ancestors have always done. And so I'm so happy that you guys are all here. And oh, I have to admit somebody else. I'm so happy you guys are all here. And I just wanted to give Koelehua and Noel a little bit of time to say aloha and yeah, whatever's on their heart, and then we'll get into introducing our beautiful midwife. So you want to go first, Kawai?
I can go. Aloha everyone. My name is Kawailehua, or Kawai for short. Me and Jordan are kind of life twins, because I also have 3 kids. My first is in the hospital, and then my last 2 are at home. And she's the one I talked to, and that's how I met Dr. Lori. It was like an immediate thing. My husband and I were thinking, like, okay, what are the options? Because I wanted to be a little bit more natural, because my son, when I gave birth to him in the hospital, I had an epidural and all of the things. And so I didn't want that in the first place, but I was young and I didn't have anyone to advocate for me during that time. So that's why that happened, but all good. This time around, I wanted to really be natural. And so that's why we decided to go that route. And then actually for my first home birth, we didn't like decide that we were going to do it until I was like 7, almost 8 months pregnant, probably. Cause we were just like, we'll see. But I'm so happy that I did it. It was such an amazing experience. And ever since then, I've been like, anyone that I know that is pregnant, I'm like, you can do this. Like, you were made to do this. You were made to do it. I mean, whether it's in a hospital or at home, your body was built for this. And so, yeah, it's so funny that you mentioned like how she asked what have you been eating? Because for both of my pregnancies, diet was a huge thing for me. And it wasn't like super important, I guess, before. But now that is very changed. Everything is about diet. But I think that's all. I mean, Jordan did I agree with everything that Jordan says. Like I said, we're life twins. But that's
You're
all.
the best. Thank you so much for sharing that. And then obviously the mom that basically was one of the top ones to recommend Dr. Lori was Noelle. Noelle can share her story. She is like a seasoned home birth mom. So, I mean, I feel like I'm introducing you and just like rallying you up, Noelle, because she has 4 kids and all of them were at home, guys. She didn't, she just went straight to it. Just did it. So go, Noelle.
Well, okay, yeah. Thank you, Dr. Lori, for being here, and thank you, Kawailehua and Joel. Sorry, I'm gonna try to run away from kids' voices, but yeah, I thought it was such a good idea, so much fun to bring our midwife on, because you guys, she's a gem. And I had friends that had home births before, and they said, like, even if you aren't considering a home birth, just go see Dr. Lori, just go have an appointment with her, and just meet her, because you don't have to have committed to a home birth to go see her. She practices any type of care for a woman and a baby, and so she's an excellent person to get guidance from at any point in your birth. I just happened to go see her and loved her, same. And I want to be really honest with you guys. You guys all know I'm honesty queen, that I wasn't one of those people that was like people always say, wow, Noelle, you're so brave and strong for like having your first at home. And I'm always like, it was not my intention to be like brave and strong to have my first at home. It just happened. And I saw the business of being born, and that coupled with like getting to know Dr. Lori and loving her spirit and her energy and trusting her, and then watching hospital setting, is really what it. I trusted home birth over the hospital. That's basically all it was. I don't know if I was like, I'm made to birth and I'm confident. It had nothing. It wasn't like that for me. And even after my first, Dr. Lori can attest to this, that I wasn't sure that I was going to have my second at home. And I'd always gone to traditional, it's not traditional, but I've always gone to see OBGYN through, besides my last, because I was like, ugh, I'm so over that. Why was I going to see the OBGYN when I have Dr. Lori? But, and Dr. Lori knows I'm always in my head. And so you can be that kind of person and still have successful and healthy home births. And it was honestly with my fourth, it was like this, because he's my last, and it was like this huge relief, and like I don't even know how to explain it, but like celebration. Like, I've had 4 healthy home births with this woman guiding me, you know, and it was such an amazing feeling, because it's like, you know, when you're going through it, having babies, you don't really stop to give yourself credit and stop to give people around you credit. And it was kind of like I had this moment of like, I had not had one complication, and I'm just so thankful for that. And I attribute that to home births. Literally, I attribute having healthy births to being able to birth at home, and Dr. Lori is the midwife who makes that possible for so many of us. So that's my story. Thank you, guys.
Awesome. This is totally taking a different route, and I love it. I mean, like, you know me, I'm so like, I have notes and I have agendas, but it is what it is, and I love that this is how it's going. I did want to mention too, just a few things that we used, that, because, you know, the reason why we're here and why we're all being related here in this group is because we all use essential oils, right? So Kawaii Hua is a leader on my team, Aloha Aila, and Noelle has Aina oils. And we also invited a bunch of our cross-sign sisters to come here, and we're so thankful that everyone has been able to join us. We have an amazing relationship with these cross-sign organizations in Hawaii and throughout the world, but mostly Hawaii, and it's really big with mothers. It's really big with motherhood. I feel like, I don't know the percentage, it's a pretty high percentage, but when you get into oils, when you get into this natural medicine, it's never really about yourself, it's about your keiki first, right? It's about your babies. If your baby is going through something, I know for me, I needed something for asthma and for my son, and that's what I did. I turned to natural remedies, and that's kind of why I'm here, basically. And so I really think that it's important to acknowledge that is one of the reasons I would not have met Lori if it wasn't for cross-sign relationships that we've cultivated through this business of holistic medicine. And so I did want to share something really short, because we are in the month of June, and June, you know that doTERRA, we have so many different awesome products that get promoted every month. But the one thing that I've recommended for each pregnancy that I've used was a perineal spray. And what that looked like for me was Immortelle, which is the product of, or not product of the month, but it's a free product this month if you do a 200-point order. But Immortelle is doTERRA's anti-aging blend. And this oil has like everything skin and healing in it. And so you have like frankincense and helichrysum and Hawaiian sandalwood and rose. And so these oils together make a really great blend for your skin. And so what I did for this, and I believe Kavailehua did it too, and Noelle did it too. I think I actually got the recipe from Noelle. Was it's like 30 drops in a 1 ounce bottle. You fill the rest with FCO, and every time I use the bathroom, 6 weeks before my due date, I would spray, spray. And what that does is it kind of like creates more elasticity in your skin. And I didn't rip for both baby. I did for my son, my first birth. I tore, they had to do a couple stitches at the hospital, but for my daughter and my son, who I want to say they had pretty big heads. My son was kind of crazy, right, Laurie? It was kind of a nuts birth. Let's just say a lot of ice down there afterwards. But both times it was smooth sailing as far as the no rip, no tear department. And I think I can speak for Noelle as well, that she has had really good recovery, and that has been one of the tried and trues that we've used, is that Immortelle blends with coconut oil and spraying it 6 weeks before, and if you just put it by your toilet every time you use the bathroom, is kind of what our go-to has been. So yeah, Kovelehua and Noah, did you want to add anything? I know Noah in the chat said yes, Immortelle is her number one. I know Kovelehua and I personally have used clary sage for our births, and it's clary sage and myrrh. Whenever I smell that, it takes me back to birthing Ihi at home, because Lori went onto my oil shelf, grabbed the clary sage, and just was massaging my heels and that, that birth, what is it called? That labor spot right on your ankles. And whenever I smell those two oils together, I always just get taken right back to birth. And I'm just going to say it. I love birth. I love pushing babies out of my vagina. It's really great for me. So that's just a little bit about me. And I really do have to give it to this lady that has made it such a beautiful process for me. So, yeah, let's
one thing.
Yes, go for it.
Well, yes, Immortelle for sure is like, I just want to say that, like, for women, like, you don't need the stuff, but I would say like emotions for sure for birth, and then Immortelle just for healing. And literally, like, I never try to overcomplicate it for people asking about birth oils, because you could do everything under the sun, but it's about keeping yourself healthy and like your mind healthy and your emotions healthy, and then just like skin, healing and elasticity. So I just keep it simple.
Yes, everything that you just said. Okay, so without further ado, we've talked about her for the last 20 minutes. Dr. Lori, we're so thankful that you're here and that you have carved a little time for us. We know how busy. I'm literally texting this lady for like the last week, because I had mastitis and Ihi had this crazy knee infection, and we have just been back and forth, and like sometimes I'd be like, I'll see you at 8 p.m. on Friday. I'll see you at 8 p.m. on Friday. So thank you so much for being on. And yeah, maybe if you want to start by just a little bit about yourself and how you got started with natural medicine and midwifery.
Okay, can you hear me? I feel, first I have to say, I feel beautiful faces, and I just want to cry. But, I have low battery now. Suddenly.
We can still hear you.
My charger's stopped. Okay, so I'm going to try to figure out what the low battery thing is, but you can still hear me good? Okay, hang on, I'm going to just switch to my phone. Oh, no, I can't do that.
It's charging.
It's charging. Okay, well, there you go. You're all back. Okay, great. You're on the picture now. Sorry, my husband's trying to help me. Okay, so I really appreciate you all being here. And, all you mamas, all you faces, all you people, these amazing mamas and babies coming into the world, I just feel like this is where it begins. So I got involved in the whole midwifery natural medicine because, first of all, I really felt like there was, this is life coming into the world, right? And it's such the most powerful time. And I was going to work with babies and kids. I didn't even actually know that much about the birthing part of it, to be honest. I was 20 something. That was 30 something years ago, and over maybe a couple thousand babies ago. So lots of babies and lots of years ago. I really felt like there's got to be something for the babies and kids to create a life that's really peaceful and powerful, and that's the beginning. So I started working with the babies and kids, and a mother came into the office, and she thought she had food poisoning, but she was having her baby. And that was my first birth, and I was very excited in that birth, and that, supporting labor and supporting birth and then supporting all the time after was just the most precious thing I could do with my life, really, honestly. So then I started learning, and all kinds of different natural means of allowing mothers and babies to come into the world in the most peaceful way possible. That's what I would say. So whether it be, I was thinking about the oils you folks are talking about, and I carry some oils, and I ask moms, and if they have things in their tradition or their culture that they want to use for the birth that they feel comfortable and connected to, because when you have things around you that are feeling that make you feel safe and powerful and really loving and with lots of oxytocin and that kind of feeling, when you have those things around you, then you can really do anything, right? We know that we have our support team, we have our friends, we have all these things so around us that make us feel very, very powerful. So that's a beginning. You can bring things to your birth, and oils, for example, like the clary sage Jordan was talking about. And I also bring helichrysum. I just wanted to mention, to put a drop in the water, so it helps make everything more stretchy. Just a drop sometimes, or maybe in the hot compresses that are going over the perineum. That's helichrysum. And then I always bring like something for postpartum cramps. Those are the main three things, like for the emotions during labor, like things obviously like lavender, and then for birth and for cramping and for the tearing, to prevent tearing, and then for the postpartum part. So white fur or Siberian fur, that's a really good one for cramps and other things too as well. But anyway, I just wanted to mention that before I go on to other questions, because it was on my mind, as far as there's such wonderful things to use, and to surround yourself with whatever culturally or whatever traditionally or whatever resources you feel make you feel more powerful. That's what I do.
Beautiful. So you already answered the question of how many births you've done. So a couple thousand. Wow. That's amazing. Holy moly.
It's a lot of so much honor.
So much. So amazing. So this is a question that I get asked a lot, and I'm sure that you could touch upon this, but what are some things what are the benefits to home birth versus hospital birth?
So I think that one of the main I could say about the differences or actually the benefits of most powerful and relaxed. So some people, when they go to the hospital, they feel really powerful and relaxed, and they feel like they want people to tell them what to do, and they want people don't want to, some people are more in that mode. For those people, being in the hospital is then you don't take responsibility, want to feel powerful, do what feels true for them. They want to be in an environment for the benefit for them not turning. And then people feel they don't know.
You're cutting off a little bit, Dr. Lori.
Or when you're out in people. Okay, let me just see.
Sorry.
Okay. I'm just gonna try. Is that, and I can also go to my phone if it's, if my battery sort of runs low, I'll just switch over. Sorry.
That's better. I can hear you. I can hear you much better. Yeah.
Uh-oh. Shoot.
Okay. Can you hear us better now? Sorry, guys, a little technical difficulties. That was such a good question. Question. I'm really excited to hear what you have to say about that. Let me try.
Okay.
There you go. I see you. Gotcha.
So sorry, everybody.
No worries.
Okay. Can people see? Okay, awesome. All right. So I was just saying that yeah, the benefits are really individual, but really it's a time and space for people to be able to make really take power for their birth, and to be around people that they're comfortable with and they know really well, and that they don't have to feel afraid that other people will walk in on them, that they don't know if they bonding that you get like with your immediate team, and being able to use whatever you want to use and eat whatever you want to eat and drink if you want to. We're not like preparing you for a C-section, obviously. So it's a really different experience as far as what your whole perspective and what your feeling is for that. The other thing is that, like I said, the bonding, for bonding for the baby for after the birth is a big piece. So one of the big benefits of people choose a home birth is because they actually don't want that cord to be cut, for example. And in the hospital, they let it pulse for maybe 30 seconds, maybe the longest would be a minute or 2 minutes. And I just had this amazing birth where the cord pulsed for an hour and 14 minutes. Like pulse. So the placenta delivered in 20 minutes, right? Or, the normal time. But the cord was pulsing. And every time we were going to go, okay, we can cut the cord now. And I would feel it and it would be pulsing for an hour and 14 minutes. And one of these OBs just told my client that, no, it never pulses for longer than 2 minutes. And so I was like, definitely not. And then we don't take the baby away, obviously to a warmer. We do little measurements and check things and everything right there on the bed and right there on you usually. So it's a different, and then you never have to separate. And then we come back and visit you. You don't have to go anywhere, get in a car. We keep coming back.
That was a huge thing for us too, is when you said, no, we're going to see you every week for the next 6 weeks. I was just like, okay, I'm sold. I would love to see you and to just be home with baby for as long as I can. And seriously, guys, like, they are so on it. It's crazy. And sometimes, she'll check in on you and be like, I'm not going to tell you when I'm coming because I want you to be laying in bed. And I'm not going to tell you exactly when I'm around the neighborhood because you should be sleeping. You should be horizontal. And I think just having that, in my mind, it was healing. It was that after healing, right?
Yes. You know what? I was just noticing that people are texting and chatting or questions, right? Or something like that. So if someone asked about the cord, I think it's a really important thing to think about what the cord is doing. So now there's a lot of research that there's really important stem cells in the blood that comes through to the baby right after. And when you cut the cord too soon, then you're not getting all those really important stem cells and all these really important nutrients that babies need. And none of us know for sure what that's going to be, right? It's kind of like a mystery, the magic and the mystery, but at least we know we're giving the baby what it needs. And people worry about, too much blood going to the baby or too much blood going back to the mom, but we're not holding the baby like way up here and training the baby. We're just letting what's supposed to go to the baby go and letting what's supposed to go to the mom go there. So that's kind of a cord thing.
I love it. Awesome. Great questions, guys. And don't ever feel shame about asking them because 4 kids later, 5 kids later, we're all learning together. And I think it's just so important. this is a very, very safe space, and feel free to ask, whatever you can. And thank you for checking the chat too, Dr. Lori. That's awesome.
Yeah.
So I know you kind of covered, some things that you recommend for birth, but what are some things that you could recommend to prepare your body for birth?
So, you're probably gonna, some people really laugh at this, but I always, I tell people that one of the best things you can do to prepare your body for birth is to have loose hips, right? That's what I tell everybody. So I'm like, belly dance, salsa dance, do anything that you can to keep your hips really open and loose. So the thing you don't want to do is like 100 squats a day, because that is making like tight thighs. But dancing is awesome. And oh, one little comment about dancing. I once had someone that did Tahitian dancing. So you have to be careful about Tahitian dancing, because Tahitian dancing is not as loose as I thought it was. It's actually really, really like uses a lot of muscles. It uses a lot of muscles. So you want to do something that makes your hips loose and your body loose. So being loose, and then if going on that same theme, being loose not only in your body, but being really loose in your mind and loose in your heart, I guess I would say. Mamas and talking to them about an upcoming birth. There's a lot that goes, especially nowadays, there's a lot of fears and a lot of issues with the mind, people telling them stories about how dangerous and how painful and how all these things. And really what you want to do is let all that kind of just be loose, like put it on, it's out there, you're not in denial, but it's not necessarily what's going to happen to you at all. And if you get hooked on that and you have this, oh my gosh, it's going to be painful, then you're going to create that experience for yourself, or more likely. But if you're like, oh, who knows? I might do this, I might do that, it might be like this, then you'll have that looseness and that freedom and that flow to create a magical, totally experience that's yours.
Yes. When you told me no squats for 10 months, I was so happy. Thanks. Okay, awesome. Yeah, we have some chats coming in. Cool. So what are some other tools? So like educational classes or anything else that you would recommend for a home or a natural birth?
Mm-hmm. I'll tell you, I have to tell you a story, folks, that I just have to share because it just happened with birth, and it kind of has to do with this question. So I had a mama that had her first baby, and in her first baby she tore really at the hospital, and she tore really bad, kind of pretty bad, and so she was really afraid of tearing again. So we talked a lot about it, and about the perineal massage and the perineal preparation, and she was an amazing photographer. And when the birth started happening and her baby was coming and the crowning was happening, I saw her just take her fingers and bring it right down to the opening. And it really felt like her fingers were talking to her perineum. They were like, saying, it's okay. It's going to be fine. I mean, I could almost like see, and she left her fingers there and gradually moved this really quite large head out with not even any tearing, not even a little stretch mark or anything. And as she did that, and she birthed her own baby, and she brought her baby right. I had no hands, and she brought her baby right up to her chest, and she was hugging her baby. And she said, "That's so wonderful," and she was so happy. And later I said, how did you learn to do? I mean, how did you just do that? What made you just do that? And she said, well, I watched all these birth videos, and everyone else was doing that, so I thought I was supposed to do that. And it was great. It was great because the birth videos she was watching were of women that were helping their babies out. And so she just like went right into that zone and into that space. So I think that, seeing videos of that kind of powerful moments that's helpful. And classes like there's the Birth Believers class, right? The Birth Believers class has these great videos, and it has great educational tools, and it gives you intellectual tools so that your mind can like, oh, I got that. And then it can just shelve it somewhere. So when you go into the zone in labor,
then you'll have it. You embody it already. You don't have to think about it. So those classes like take care of all those fears, all those questions, all those doubts, and then you can just get into the zone when you're ready to get into the zone for labor. And there's some people take hypnobirthing classes, some people take yoga classes, or belly dancing classes, or all those different things. And those are all great ways to get yourself ready. Or just shake on your own, put some music in your living room, do that kind of stuff.
Yes, I love that.
I want to say something too about like preparing, because I'm not trying to like make everyone have a home birth, but again, after my fourth like really healthy one, advocate more for it. And I've had friends who are like ask me, well, do you know about this, and did you prepare for this, and did you read that? And I was always like, when you have a good midwife that you trust, and I'm sure having a good doula could also help as well, but a midwife especially that you trust, you don't need to do all the research yourself, because I know that Dr. Lori has a lot of it covered, and so I felt like that was like half of the stuff that I felt like my friends going into the hospital had to know, because they had to advocate for their birth. I don't have to do, because Dr. Lori is going to do that for me. And so I just had to focus on going inward and listening to my body. And I know that not everyone has the same experience, but I felt like there was like a huge thing lifted off my shoulders because I had someone that I trusted, that was there to advocate for my natural birth. Like she wasn't there, that I didn't have to worry that, and she had any other intentions but a healthy birth for me. So just wanted to put that out.
Totally. And that just in itself, it just already creates a pale almost, right, around you for a great birth. So yeah, awesome. We did have a question in the chat, Alyssa. Wait, let me scroll up a little bit. Another question. Is all home births, oh my gosh, sorry. Is
Right.
all home births?
I saw that.
Oh, you saw that? Okay.
Yeah, but I was thinking that the thing about birth, it's like I've been to maybe over 2,000 births, and honestly, none of them are the same. None of the same. And that's, of course, what the magic and the wonder and the mystery is for me. And having said that, some moms decide they want to birth in the water, let's just say. And they're in the water and they're birthing, and then their baby, for whatever reason, decides that's not the place for me. So then they get out and they birth on the side, or the stool, or the birth stool, or the bed, or the bathroom. Or some people are like, I had one dad that was like set up the birth stool with the cameras, and it was like her 6th birth, and he's like, when they captured this on film, I haven't figured out. And there she is in the corner against the wall, against the window, or whatever it was, and with delivering the baby. And the dad is like to me, can you make her go on the birth stool? Can you please? And I'm like, probably not. Probably not going to happen. So some people birth where spontaneously in the moment, where it feels most powerful and most for the baby and for the mother. So sometimes it's all about the communication. Sometimes in water, sometimes not. I think there was another question about, is it messier or neater or something like that. But you can have your birth in the water. It's all contained in there, and you get out, and then you bleed some, and they can be messy too. So it's it's not about where it's messy or neat. We just kind of clean everything up. It's really easy. We got Chuck's pads, and get a good assistant. And some people are like, after they're lying in bed, they're like, where's everything? What happened? It's all gone. And it looked like the birth never happened, but we know it definitely happened. So yeah.
That's what I was gonna add too, is the next morning after after having a water birth, we woke up the next morning and it was like my regular living room and my regular house. Like there were these just birth fairies that just cleaned it up and it was gone. And when you birth with a midwife or a home birth, midwife, they really guide you. I know that Dr. Lori really guides you through everything that you're gonna need, all the steps that you're going to take. I never felt ill prepared. We had a birth box, just like moms that go to the hospital have a birth bag. You have that, and you have that ready, and you're just waiting for that baby to come. And I think the last thing I had to worry about was my house being a mess from a birth. It was actually the opposite, really, really the opposite. There was another question too about having a C-section.
Right.
Yes.
So I really wanted to mention that, you know, people have ideas that you only if you're like certain kind of in a certain kind of condition, then you can have a home birth. So what I tell people is that, you know, it's not a hard, fast rule at all. So definitely people that have C-sections, the convention, because they might perceive that it's more dangerous or it's high risk or different things. Now, I'm not saying that it's not, and I don't know, you know, the particular case, right? So, you know, I don't know your particular story, but I know that people, like, I don't know if I should be saying this there's probably 30 people online, but I'm just going to say it, you know, because I had this mama that had, and this might shock people, so I don't know, but, you know, had 3 C-sections, and that sounds crazy, but she had 3 C-sections, and she was like, I just can't, and she didn't plan to have a 4th child, but she did. She was pregnant, and she's like, I just feel like I can't have another C-section. So she was just wanting to get someone in the hospital, actually, to try to allow her to have a vaginal birth trial. And no one would do it. And they said, you know, things like, you're going to leave your kids orphans, and just things that were really sad and mean to her, you know. So she came and we talked about the risks. So we always talk about risks, risk factors, and about how important it is to be able to and about your exploration. Like some people were saying, I can't believe you even reached out to someone because that's so dangerous. And so we talked about it, and she said she really felt like she was willing to take the responsibility, and she really felt that that's what she was supposed to do. And I'm telling you, she had the most amazing, peaceful, caught her own baby again birth. She did have to have very specific things though. We didn't want her to have another C-section, obviously. So she had to have it totally quiet. And one thing, like totally, like I couldn't even open the little cord clamp package because it was too noisy. So we had to have it super quiet. And if she had it super quiet, she could get in the zone. But as soon as someone made a little crinkle noise, she was at the hospital. You can't have it totally quiet, and always had bothered her. So, so anyway, I'm not advocating for having someone that had many C-sections to have a home birth by any means. I'm just saying that you don't ever want to, you know, give up the opportunity of exploring options. That's all.
Awesome. Someone also had the question about being a midwife compared to being a doula.
Okay. It's really tricky actually, because there's different kinds of midwives, and then there's different kinds of birth attendants, and there's different kinds of, you know, birth support people. But a difference between a midwife and a doula is that a midwife actually is experienced in the process of delivery, versus a doula is really there for all the labor support and to assist. Really, it's language, but not necessarily experienced in maybe the different things that could happen as the baby is actually delivering, or even in labor, some of the signs and symptoms maybe of a baby that might be in distress or a mother that might be in distress. So it's just a little bit different. Does that make sense to whoever was asking that question? You can ask further if you need.
Awesome. Pua had a good question too. She kind of was going back to the squat theory. So what other exercises would you recommend to strengthen your whole body and loosen too during pregnancy?
So I'm glad you mentioned that, because there's a really good website called Spinning Babies, right? So spinningbabies.com is a website for babies that sometimes, well, I think it was designed partly for if babies are in a not ideal position. And what ideal position means, if they're posterior or if they're breech, sometimes people would want to do certain exercises to have the baby be in a more favorable position. So I'm sure people know, but a posterior baby is, they call it sunny side up. So that means that the face is facing front and the spine is facing in the back. And when the spine is facing in the back, it's spine to spine, right? So it's your spine, a baby's spine against your spine, causes more back pain, usually. Although some people's pelvises and their structure makes it easier to have a posterior baby. I one time had a mom, no back pain. Baby slid out, face up. It's super easy. And I was like, oh, did you have any back pain? She's like, not a bit at all. So her babies came out posterior for whatever reason. So it's not a 100% thing, but definitely you can go to the website and you can do these really great exercises, you know, because what's interesting is some people feel like babies are in the wrong position. They say, oh, my baby's in the wrong position. And I always like suggest gently that maybe the baby's not in the wrong position. Maybe for whatever reason, your back is tight or your hip is tight, or maybe you're in the car too much or slouching on the couch a little, or maybe whatever it is. And they actually, you know, you need to change a few things with your body so that the baby can get in a better position. It's not necessarily the baby, you know. So it's both. It's both, I think.
I love that, working together to help baby out. Yeah. Okay, cool. So we're kind of getting into now the labor phase of it, right? So what do you recommend for naturally inducing labor? I know for me, it was a few times that I was like, I really want to give birth already. And I'm sure you've had this so many times of like, I'm approaching that 42-week mark, Dr. Lori. Like, what are some suggestions that you would have for naturally inducing?
So, you know, here's a good another point for your oils, actually, for the oils, is because people are always, when they get like close to their due date, are kind of like, well, not always. Some people are like, I'm not ready to have the baby. And other people are, I need to have this baby. And then they have this sort of like adrenaline or a little bit of this kind of feeling about it. And that is actually for bringing babies in, because oxytocin is the love hormone, right? And if you are in a place of anxiety and stress, the love hormone is kind of like not as close around. So I always tell people, so oxytocin and adrenaline are counteract each other. So the first thing is to not be in stress, which is not that easy, but you can do it. Everyone can do it. And you can use oils, you can use teas, you can use friends, you can use being, making love and frontal hugging, like lots of hugging and cuddling and kissing, and all those things that bring oxytocin in are wonderful inducers to help that going. Low lights, like things that are very calming and peaceful. So that's oxytocin. And the other thing is to help get your uterus muscle nice and strong and tonified, right? So some people do it with herbs like blue and black cohosh, or some people do it with things like clary sage. Some people do it with hiking a really great mountain. I'm all about taking moms on hikes, like 20 minutes uphill, not a little hill, like, but maybe not Cocoa Head stairs, but 20 minutes up, like a pretty nice hill, and then 20 minutes down, and then some spicy food, and maybe that will kind of get the uterus a little bit more tonified and ready. You don't need to do the castor oil. That's kind of like way down the end of the road. But that is like another natural thing that makes people have pretty strong cramps and not very comfortable. And then sometimes they go into labor.
Awesome. What is the mana'o, the theory behind the 20 minutes uphill? I remember you explaining that to me, like, and also the 20 minutes downhill is just as crucial, right? Yeah.
So up and down hills, like up and down hills is not quite the same as doing just like 20 minutes up and then 20 minutes down, because there's something about keeping going up, first of all, that gets your oxygen, like gets you really breathing. So there's so much more oxygen to your muscles. And then the coming down, the part that's really important is that you're like getting that baby in the canal, deeper sort of, as long as it's in a good position, and consistently, with each kind of step, a little bit more. And it's kind of like when you're bouncing babies, or same idea, it's just the idea that you're moving that around, you're moving, getting the energy moving, and it's extended for an extended period of time. Because, you know, when you walk up and down, it's still, you don't always get that super aerobic feeling, a little bit, but if you go up, 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 you're like breathing deep for that amount of time.
Right, right. So awesome. We did have a question from Brittany. So she has heard stories about babies with cords wrapped around their neck, and heart rate dropping. Are you able to determine that, to predetermine that, or can you have signs of that?
So some people actually say like, oh, can you get an ultrasound to find out if there's cord around the neck? But the problem with that kind of thing is that cords are sometimes around the neck, and then they're not around the neck, and sometimes they're around a couple times, and then babies swim through and they tangle with an arm, and they do all kinds of things with cords. Who knows what's happening? They're having a party right in there, or they're stressed, or they're sleeping and it gets around them. So then at one moment there might be a cord, and then at another moment the cord's not there. So you wouldn't want to like see the cord there and be like, oh, well, there's a cord, maybe we need to have a C-section or something like that. You know, cords can 99% of the time, maybe even more, can be easily dealt with right at delivery. So right at birth, there's a cord. You can take it around the head. You can take it down the shoulders. I had 3 cords once with a hand all tied up. We've had knots in cords. We've had lots of things in cords. But you know what? Babies and moms, and they figure it out. They figure it out together.
I actually for Ihi's, we had a GoPro underwater. I think I showed you the video, yeah, Dr. Lori. And I think she had a double wrap around her head. And Dr. Lori does this really great job, and she actually lets you know beforehand, like while you're still in appointments. And if there is a cord, you know, she'll check and just see if there's space between it. If the cord is still pulsing, it's a really great sign. And in the video, you can see her just go, wait, there's a cord, and then shoot, just gently, just literally like this, boop, over the head, and he came sliding out, and it was, I didn't even know what was going on because it was just so like quick, and it was twice. And I think a lot of times we get worried and we get scared because of, you know, either we hear that so often of there's a cord and baby's gonna choke, and I think it's sorry, my mute. I think it's just cool to hear different experiences with it. But yeah, great question, Britt. We did have a few more. I know we're kind of getting on to the hour, but someone had a question about getting pregnant. So kind of backtracking a little bit, like what are some things that, if you could tell us, if you recommend to prepare your body for getting pregnant?
Gosh, so many things. I know I don't want to over talk. I feel like everyone is, you know, I feel so honored to have this time with you all. Again, I think the biggest thing is how nourished someone is. So like you can look at, you know, preconception counseling. When I was doing births, I didn't realize you could actually give even more, right? And do preconception and think about, okay, is someone's, does someone have, how high good is their iron and how strong is their blood? And there's Chinese herbs and there's Western herbs and there's blood builders to help get, you know, so that you're not anemic when you get pregnant, first of all. And then also that you have, you know, how to, like, you know, how the first trimester people have that not pregnancy, morning sickness, things like that. There's ways to actually really help prevent that or minimize it. And that's again about how nourished you are when you're going into it, how nourished, and like, you know, kind of, if you're going to run a little marathon, you don't want to like just get to the starting line and then just run it. You want to practice a little. So like if you're walking or you're exercising or doing a little hiking, those kind of things actually really help your oxygen, help your ability to get pregnant, you know. And then the biggest thing about getting pregnant, if you were talking about fertility, is to, you know, again, not be that stressed, to actually have time with your partner and have time with yourself as well, to really get in touch with that place of you, in place of, you know, that wants to bring life into the world in a really conscious and powerful way. So stress management, meditation, deep breathing, good oils, you know, nature time, all those good things.
Yes, stress is definitely so important to getting pregnant, not having it. Um, I have one more question that I want to end with, but we did have one from Havel asking, she had a hospital birth and everyone in the room was yelling, "Don't push," but she felt baby was moving and was fighting her body regardless of what she wanted to do, right? How might you deal with that in a home birth setting?
Well, so the biggest, again, we talked about one of the biggest differences, and one of the biggest differences, again, I think about a home birth or out of hospital, is really allowing the body to listen to its messages, right? So that's what we're all about, listen to your gut. Women, we're so intuitive, right? And we have a really deep connection to our center and our intuition and our instincts. So most of the time, I mean, there's going to be, exceptions to every rule, but most of the time, if you're feeling like pushing, even you might be at a 9.5 and they're like, no, don't push because you're at a 9 and you still have a little rim of cervix and you don't want to tear your cervix. And I understand that. So there's reality to all of these things, but most of the time, your body knows what to do. It's not going to over push. It's going to just push just enough to move that little quarter centimeter, whatever centimeter away. And that's what we need to allow it to do. And we need to trust it. And like, instead of coaching, okay, here's a contraction, now push, it really makes much more sense to be like, I'm going to wait till my body feels like pushing and then I'll push. And that's what makes it difficult with the epidural, obviously, because you don't know, your body never gets that message that as clear.
Yeah, that's a big one too, because when I gave birth in the hospital for my son, that same thing, Havel, it was, you're at 9.5, you can't push yet. And I was like, but my body is telling me to, everything is basically vibrating in my body saying, I need to push this baby out. And when they gave me the 10 go, I was like, let's do this. And then fast forward to Ko'ola, who is our baby, 10 months old yesterday. Oh my God. I had the urge to push kind of early on in it. And I told Lori, and that's the thing, the communication is also really important, right? And so I was like, I think I need to push. And she said, okay. And whatever I did, I didn't push very much longer after that because I still had a little bit more ways in my labor. But that feeling to push just helped everything just kind of release. It didn't mean that maybe at that time my body didn't need to push for a full whatever baby needs to come out, but I needed to push just right at that instant to allow my body to release that, and then I could continue on the labor. And so, I always tell moms too that you're also not the person that is talking right now while you're giving birth. You are in another realm. You are in pole, whatever you want to call it. You are someone else. You're still you, but you're someone else. You are bringing a baby into this world. And so you have to be really connected with that too, and making sure that you're taken care of and that you have a good set of people around you and you have, tools to help you. So yeah. Don't cry, Kualiku. And now we're all gonna get pregnant. And now you're gonna have 34 births next year, Dr. Lori.
No.
But
I am not getting pregnant.
I'm sorry, Noel's not getting pregnant.
No, Noel, no. One more question. Did you have one more question, Jordan?
The last question that I had, if everyone else is good, we're kind of running on the 9:02. Just what are some any quick tips or any just advice that you would have for mothers that are wanting, not necessarily home birth, but are wanting to go this unmedicated birth, a natural birth?
So, okay. So I was just thinking, that kind of goes with this thought I had about intervention. That when the conventional world, and I'm not dissing them at all, I'm just saying it's different perspective. When the conventional world says, oh, we need to do this ultrasound, or we need to do this test, or we need to do whatever these things are, and you're like, oh, I don't know. I don't know. I don't know that I want to do that extra ultrasound, or I don't know that I want to do that extra test. And they say you have to do it because of this, because your baby could die, or because of this condition, or because all these different things. It makes you very fearful. So the answer to the question, I feel like, is that this world is really a world, especially right now. It's a world that is a little bit bound in fear, and though fear and pain can be really good teachers to us, they're not necessarily what we want to live with, or not necessarily what I might choose to live with. And I think that for people that are wondering what to do, or just want to have a natural birth, but there are all these stories, they have to. It's important to feel what it will take to be out of fear, to be in a trust paradigm versus being in a fear paradigm. Because if you're in a trust paradigm and in a powerful paradigm and in a place where you feel really vital and alive and being able to make decisions for yourself, and you can do research. I'm not saying just to, only to trust your instincts and intuition. You can read and talk to people, but it's a place where it's a different paradigm. It's a place where you're like, oh, wait, this actually makes sense. Like, maybe I don't need an ultrasound every week, or, and why? Okay, well, maybe that I know my baby's there, and maybe we can feel the position already, or maybe, I just don't want them exposed to this. Just, I don't know, it might not be bad, but it might not be great. We don't know 100%. So like, those are practical decisions and choices you can make if you're fearful, like, what if my baby has all these conditions, and what if this, this happens, and what if that happens? Then then you're going to make a difference. You're not going to be able to get into a place that's not ridden with the fear paradigm, right? Because you're going to be in the fear paradigm. So that's one idea to think about, to how to get into that other space in a powerful way.
That was the perfect outro exit to this. If anyone has any questions, Dr. Ori, are we able to email you or communicate through, I know we can, right now COVID-19, but, setting up an appointment if you guys want. Dr. Lori is with Sacred Healing Arts.
Yeah, I was going to just say, if people have questions, or like, I love this chat thing. I was trying to follow it, but I'm not so good at the chat thing. I'm like, keep blocking people out. So, I'm super happy to, like, if you want to shoot me, like, or through Jordan or through Kavai or Noel or however, and you have other questions, you can shoot them through them and they can bring it to me. You can also email my office, which is sacredhealingarts@gmail.com. So sacredhealingarts@gmail.com. You can put attention to Lori, Dr. Lori. I have to tell you, I'm personally not great at answering my personal email, but my office is really good at answering the office email. So then you can ask a question and I can call you back, or I can email you back and they'll let me know. And I'm really happy to do that. I'm also happy to do consults, free no charge consults, even if you're not pregnant or if you're thinking about getting pregnant, or if you are pregnant but you're not interested in a home birth. All of those things are totally fine. We're not trying to convince anybody, obviously. We just want to give information and get people educated.
So beautiful. Thank you guys so much for coming. Thank you, Dr. Lori. This was such a pleasure. We're so grateful for you for being able to come on. And thank you, Kavai and Noel, for being my co-host, even though I felt like I talked the whole time. Sorry. But yes, thank you guys again for being here. And I have this recorded, so we will definitely be sending this to your team leaders. And again, Dr. Lori, we love you so much. And thank you so much for everything that you do for our community, for our mamas here.
I love you all, and I wish you all the best in whatever path you're taking.
Okay.
Love you, Dr. Lori.
Have a great night, everybody. Have a great weekend.
Thank you, Dr. Lori. Thank you guys for hosting.
Thank you for being here. Okay.
Bye.
Ahui ho.
Bye.
Ahui ho.